Great. Well, thank you, Marissa. Thanks to the Grantmakers Forum for having me here. It's great to be in Arizona. Grady, that presentation was very helpful to me as someone who doesn't know much about the state, and in understanding what we see from afar and think about this great state of Arizona. And remind me to tell you during the break how great Minnesota is, which is where I grew up. And got into this kind of grassroots organizing and social change policy work because of the late Senator Paul Wellstone from Minnesota, who was my mentor. So today I really want to talk about leverage, not fulcrums and physics, but leverage in philanthropy. And by the end of my presentation, I promise that you'll have some new insights into how you can leverage the limited dollars that your philanthropy has at its disposal to make maximum impact on the issues that you care about. Let me begin, though, with just a little bit of additional background on the National Committee for Responsive Philanthropy. We were founded 36 years ago, and for that entire time, we've been the nation's only independent watchdog organization for philanthropy. We promote philanthropy that serves the public good, is responsive to people and communities with the least wealth, opportunity, and power, and is held accountable to the highest standards of integrity and openness. And I sometimes describe us as a critical friend for philanthropy. We hold up a mirror for foundations and challenge them to do more to strengthen the communities that have been underserved or marginalized in some way. Over the years, we've seen how funding the strategies of advocacy, community organizing, and civic engagement yields long-term benefits for those with the least wealth and opportunity. And yet, we also observed that many funders still shy away from embracing these kinds of strategies for a variety of reasons. And I know we're going to talk later in the program about what the obstacles are that you're feeling, that you're facing. But one thing that we heard over and over again from foundation staff and advisors about 5 years ago, before we launched our most recent project, is that some trustees have difficulty understanding the impact of funding for these kinds of strategies. They think it's a little bit fuzzy, and they just want their grants to help people. They want to see and touch and feel that they're making a difference at helping people, and that sometimes they have trouble seeing the tangible impact and benefits from funding policy advocacy or civic engagement. So we knew that was one piece of the problem that we could do something about. We were uniquely suited to tackle that and contribute something to our sector. So we launched a multi-year, multi-site research initiative designed to rigorously examine the benefits for families and communities of foundation funding for policy advocacy, community organizing, civic engagement, very broadly defined. And as you can see here, these are some of the definitions that we used to encompass all of this range of activities, and I know that's been one of the things you all have been talking about, that there are a lot of ways to be involved in advocacy. It's not only funding one kind of thing that fits into the continuum. I think I just want to highlight a couple of things about these definitions. It's important to make a distinction between advocacy and lobbying. Can somebody tell me what they think the distinction is between advocacy and lobbying work? Anybody want to take a stab at that?
One's general, one's specific.
Okay, one's general, one's specific. Say a little more about that.
Well, lobbying is generally a particular piece of legislation you advocate and that you promote for policymakers, and advocacy is more general to education.
Yep, yeah, I think that's right. We often think of lobbying as one specific subset of an advocacy activity. It's one thing that you may or may not need to have happen in order to get the change you want to seek in the world, but it is very narrowly defined. And so the fear of lobbying should not keep funders from being involved in all the other elements of advocacy that help move an agenda forward. Public education, media outreach, research, all of those activities are definitely not considered lobbying by the IRS. Also, I want to draw the distinction a little bit between advocacy and community organizing as different strategies to achieve change. Anyone want to take a stab at what you see as a distinction between those two? Yeah.
This is organizing is sort of more of a grassroots, getting people to take action, and advocacy can be more about messaging or bringing issues to the top of the agenda.
Yeah, that's good. That works for me. We tend to think that advocacy is often professionals advocating on behalf of an agenda, and community organizing is getting people directly affected by the issues to advocate on their own behalf. So organizing could sometimes be called self-advocacy, getting those voices involved and engaged in the civic process. So this multi-year, multi-site project that we launched was called our Grantmaking for Community Impact Project. We studied the work of 110 different nonprofits from 13 states, all using some combination of civic engagement or advocacy or organizing work to achieve change. And we produced 7 different reports, so some of them were covering only one state and some covered a multi-state region. And it included red states and blue states, urban areas, rural areas. We really wanted to examine a good cross-section of our nation. And we found consistently that when foundations do invest in grassroots civic participation, that it makes a substantial, tangible, measurable difference in the lives of families and communities. The 7 studies in total comprise more than 400 pages of research, cost us more than $1 million to produce, and we released one of each of these studies about every 6 months over a 3-year period. Thankfully, you don't have to read 400 pages. We've summarized the whole series into a 10-page summary, which you all have in your folders, leveraging limited dollars. Using the methodology that we developed for the studies, which I can go into greater detail if there's interest, we documented conservatively $26 billion in benefits. This is even more extraordinary when we learned that the nonprofits received only $231 million in funding for their advocacy and organizing work. And so that computes, if you do the math, to a return on investment of 115 to 1 for every dollar invested in these kinds of strategies. Certainly a substantial bang for the buck for funders interested in producing change. We also documented through the reports hundreds of thousands of community residents attending public action meetings, communicating directly with policymakers, or joining community organizations as a result of the work of the groups in the study. 95,000 people participated in leadership trainings, and more than 16,000 became committed core leaders of their organizations. And we were also pleased and a little surprised, frankly, to find 327 different grant makers had invested in the work of these 110 organizations. It was a much larger number of funders who were at least dipping their toes in the water of funding advocacy and civic engagement work. Some of the highest monetary impacts with the broadest benefit that led up to that $26 billion figure in benefits were campaigns to raise the state minimum wage. Several of our studies had successful campaigns during our 5-year study period, or campaigns to institute cost-saving reforms in the state budgets, spurring affordable housing development through housing trust funds, creating education funding for low-income schools, or community benefits agreements from big development projects that tie for-profit development to neighborhood improvements and jobs for disadvantaged communities. So one of the things that I think it's important to note is that these are not all campaigns for bigger government, more government spending, et cetera. Many of the campaigns that we documented resulted, in fact, in substantial savings and prevented new government spending on initiatives that really weren't going to benefit families or communities very much. So it was nice to see a real mix. It's about making government more accountable and responsive to communities, not just working for bigger government. We also note throughout the studies that many of the impacts that we documented, we were unable to monetize. Many of the things are priceless, and we documented about 400 policy wins or impacts from the 110 groups, and about half we were able to put a dollar figure on and include in the $26 billion in benefits, and about half of the wins we simply couldn't put a dollar figure on its benefit. For example, campaigns that ensure the rights of immigrants or protect air and water quality or promote human and civil rights for communities of color or for LGBT communities. Many of those kinds of wins were very hard to monetize. Some air and water issues we could put a price tag on, others we couldn't, et cetera. So, health and education wins usually had an easier price tag to put on and include in the return on investment figure. Civil and human rights and some environmental issues were much harder to monetize or quantify. But the methodology that just to quickly do it, we documented each policy win of the groups. We independently verified that the nonprofits actually had a substantial role in changing that policy. So if we couldn't verify that from newspaper reports, we then called elected officials and said, was the work of this nonprofit influential in the passage of this policy or not? And we only counted in the reports wins where we could document that the work of the nonprofits was a substantial contributor to the policy change. And then you try to monetize each policy win that you verified, and that's how and then you add them all up, and that's where the $26 billion in benefits comes to. I want to talk a little bit about the diversity of foundations. You can see here on this slide the diversity of types of foundations that supported this kind of work. It's not at all limited to any one type of funder. We really saw engagement from many different kinds of funders. Now, what about the size of the foundations that supported the work? Let me see your hands if you think only large foundations were involved in funding policy and advocacy work. Anybody think it's mostly for big funders? Anybody think it's mostly for small funders? You're all too, Karen, maybe? We were surprised. It was actually really well spread out, a good diversity. Size really didn't correlate at all to Grantmakers' willingness to get involved in funding one of the groups in the study. So, funders giving out less than $1 million a year and all the way on up. It was a really nice cross-section of Grantmakers. Obviously, the larger funders are providing a bigger share of the nonprofits' budgets that are doing the work, but there was a place for funders of all size in moving this work forward. So in total, as I mentioned, we documented 400 different policy impacts. All of these are chronicled in an online impacts directory on our website, which is searchable by keyword and sortable by issue or geographic region. So if you're working on a particular issue and you want to know, did anybody in one of NCRP's 13 states in this study ever work on this, go to that database and see if you can find some examples of successes from other states. I want to talk just for a minute as well about the funder practices that the grantees reported as most helpful to them achieving their policy impacts. Before I advance to the next slide that shows some of that, any guesses on what kinds of funder practices might have been reported by grantees as being particularly helpful? Convening role was definitely something that was helpful in many cases. Ability to get folks to the table who wouldn't otherwise come or that the grantees don't have relationships with. Yeah, definitely helpful. Research, yeah. Less so. It wasn't, didn't make the top of the list, but some nonprofits definitely mentioned that.
Multi-year?
Multi-year, long-term support, very, very crucial. Policy change doesn't happen quickly, and that's one of the key lessons for funders that one is the return on investment is significant and substantial, but you can't assume that you're going to win a policy campaign with a 1 or 2 year grant necessarily. You got to be willing to stick it out for the long haul. Yeah.
Did they talk about operational support rather than program related?
Yep, absolutely. That was also very much at the top of the list. General support grants and multi-year funding right at the top. Now grantees have trouble getting enough unrestricted support, and you sometimes need to change directions quickly in an advocacy campaign. If they've got enough unrestricted general operating support, they can be nimble. They can adapt to a changing policy environment, and they're more likely to be successful and have wins. And the long-term support, not having overly burdensome application or reporting requirements was something they talked about. Relationship, dialogue, and partnerships, being able to really see the funder as a safe thought partner to strategize together. How are we going to win this thing? They found that very helpful. To not have to report different evaluation benchmarks for their 7 different funders that are funding their work. Some sort of agreement from all of the funders about, hey, this is what we're tracking. These are the things that are going to lead to success. They found that very helpful. And then the convening power that Karen mentioned was part of the leverage beyond the grant, the expertise and relationships of the staff or trustees of the foundations. Okay, so in New Mexico was one of the, actually was the first of the 7 studies that we did. We only had a few originals left in the office, so I brought 5, but the report is also free and available for download on our website. But we've got copies of a few copies of this for anyone particularly interested in reading the details of your neighboring state. I do want to just lift up a few of the examples so you get more of a flavor of the kinds of impacts that we documented next door. The New Mexico findings showed $2.6 billion in benefits. It was actually the highest return on investment of any of the 7 sites. And that was, we think, due to not the fact that their advocacy groups were any better than the groups in other parts of the country. In fact, they're a little underfunded and under-resourced compared to other parts of the country, but the study period coincided with a supportive public policy environment and a government structure that was in, with certain electeds in office that were interested in moving this kind of agenda, and it made it that much easier to get some big ticket items through on their campaigns. Thousands of people being involved in public action meetings and the leadership development that some of the organizing groups do, I think can't be, shouldn't be underestimated. It has lasting benefits for years and years beyond the time. The new skills and the new confidence that grassroots community folks develop from one set of campaigns, they never lose that, and that carries with them for years to come and helps build their capacity for future struggles. The Brindle Foundation was one New Mexico foundation that we documented the work of. They're concerned with the well-being of children and youth. They fund education, early childhood development, youth development, and human services. And as the board and the staff of the foundation explored how to make the most difference with their limited dollars, they heard the same things over and over again from leaders in their community. The community folks wanted support of the foundation to make a bigger impact, and their grantees actually convinced them that they needed to move from funding services into also funding the advocacy efforts. And so they funded for many, many years the work of New Mexico Voices for Children, and with this support from Brindle and others, that group played a key role in expanding access to the state children's health insurance program, SCHIP, which ensured 22,000 children and parents just above the poverty line would also have decent, affordable health care in New Mexico. And that win alone expanded federal funding for SCHIP in New Mexico by over $800 million over 5 years. Brought $800 million new dollars into the state that wouldn't otherwise have come to them. The Kona Alma Health Foundation was another one whose work we thought particularly highly of. They are working on addressing health disparities, and they're supporting health advocacy among marginalized populations. And Dolores Roybal, their executive director, I'll just read you a quote from her. "The foundation defines health broadly and makes grants that promote systemic change and are outcome-oriented. Thus, advocacy is an important part of our mission and purpose, and one of our core values is to encourage consumer participation in health policy formation." And so one example of how they did that was by funding an indigenous women's organization called Tiwa Women United. And they helped win a campaign to allow the state use of Medicaid dollars for midwifery services and home births. So two practices that are preferred by Native women but had previously been excluded from Medicaid coverage. So in fact, that's a win that increases choice for people. People can choose to do a home birth or in the hospital and still have it covered by Medicaid. And it actually saves the state millions of dollars, because a home birth is far, far, far cheaper than a hospital birth. So everyone who chose that ended up saving the state money on its Medicaid program. Kind of a cool campaign. The Santa Fe Community Foundation not only directs its discretionary grant making towards changing systems, it also seeks to educate their donor-advised fund holders about issues and needs in the local community, so that individual donor grant making will also be more strategic. And they had a great campaign with the New Mexico Acequia Association, helping preserve water rights and irrigation systems. And the McCune Charitable Foundation was another one that was involved a lot with the groups in our study. They're one of the few statewide funders with a strong commitment to this bottom-up grassroots community organizing strategy, and they do provide flexible core support to help make sure the resources are flexible and can go where they're most needed by the groups. One of their grantees, Albuquerque Interfaith, a coalition of faith congregations working on public policy issues, use those resources to build coalitions with public schools, teachers unions, police and firefighters, and social service agencies. And together they did a campaign that increased funding for school repairs, teacher salaries, youth after-school programs, and public safety programs. So it was a pretty dynamic and exciting campaign. I'm sure that you all have your own examples. I'm looking forward to hearing more later about the great work of Arizona groups. I got up close on the boards and was impressed by the documentation of all the great groups doing work here in Arizona. One that I'm familiar with, I'm on the board of the Leadership Center for the Common Good, which is a DC-based group that provides assistance to grassroots organizing groups around the country. A local partner here is the Arizona Center for Empowerment, which is their 501c3, and then they have a 501c4 as well, Lucha. And they've only been around for a few years, but they're one of the Arizona groups I've had some contact with, and was glad to see they're in your system. You guys have been documenting their work as well. So, one of the things I really encourage us to do is to face the fact that the enormity of the problems we're seeking to tackle it really dwarfs the finite time and resources that grant makers have. I think that's incredibly clear here in Arizona, that is not one of the nation's most philanthropically wealthy states by any stretch of the imagination. And so it's even more incumbent on us to leverage those limited dollars that we have for maximum impact. And so, I'm preaching to the choir here. Everyone's here because they're already doing it and they're already getting started. So I'm not going to belabor these points, but encouraging your peers to dip their toe in the water, get started. It's a process, and people move along this continuum as they gain comfort and see success in their efforts to fund advocacy and civic participation work. There's also an initiative that we're doing. There's a handout in your folders about it. Some of the nation's leading foundations that are committed to funding these kinds of strategies have signed on to Philanthropy's Promise, which is a sort of a voluntary giving pledge for institutional grant makers rather than for billionaires. And 128 grant makers have signed on so far, pledging at least a quarter of their grant dollars for the empowerment of underserved or marginalized communities, funding for systems change, advocacy, policy research, those kinds of strategies. So would be happy to talk more with you all. It's been a useful tool for foundations who started doing this work to focus the discussion with their board or staff about, well, how committed to this do we want to be? What's our portfolio allocation? Does it make sense for us to have a quarter or more of our resources going for these higher leverage strategies while we still maintain our commitment to service provision or other strategies? So I'm happy to talk more about that. I want to open it up for questions and discussions in just a minute, but did want to share this quote from Garrett LaMarche, former president and CEO of Atlantic Philanthropies, and he's on the NCRP board of directors. It really is the most direct route for foundations to be a part of enduring long-term social change. And those of you who are health funders probably know the crucial role that Atlantic Philanthropies played in funding grassroots organizations that supported the Affordable Care Act, or Obamacare. And they had a huge impact with their $26 million grant to that coalition. So with that, I think I'll open it up for questions, reactions, comments.